This video was produced by Dr. Dinis Carmo, an orthopedic surgeon practicing in Oporto, Portugal. What we are about to present is a new technique and set of instruments that we invented specifically for the surgical treatment of a condition known as the carpal tunnel syndrome. Carpal tunnel syndrome is a complex of symptoms resulting from compression of the median nerve in the carpal tunnel of the hand. Typically, the patient, most often a female, is awakened in the middle of the night by numbness, tingling, burning or pain that may extend from the fingers to the shoulder. Carpal tunnel syndrome is a very common condition, affecting people all over the world, and its resolution as a rule is surgical. It has been estimated that an average of 500 cases are being performed per year in the United States alone. The usual technique is to make a palmar incision right over the ligament and to cut down until said ligament is exposed and cut, decompressing the underlying median nerve. This operation is very simple and effective. The problem is that, due to the high sensitivity of the palm of the hand, post-operatively some people develop persistent pain over and around the scar. More serious problems related to certain surgical techniques have also been reported with permanent disturbance of the function or sensitivity of the hand. Therefore, we developed a new technique and a new kit of instruments that have been now used with success in more than 300 patients in Portugal alone, with evident advantages over the prior art. An international patenting process of the kit has been launched, having already been granted in Japan and being patent pending in another 47 countries. As previously shown, this is the kit of instruments, and the operation is conducted as follows. We start by cutting sharply only the skin with a beaver blade, and we perform the release of the distal forearm fascia using the 90-degree bent shaft fasciotomy. We introduce the cannulated guide rod until we feel it passing the distal border of the TCL. After that, we advance it further by about 5 mm more distally, and we introduce the flexible metal guide needle through the lumen of the rod until it pierces the skin at chosen point. Finally comes the JD fasciotomy. The guide needle is fed this time through the cannulated inferior finger-like prong, and the blade end is made to straddle the proximal border of the ligament. As you can clearly see here, without the cannula, so that the superior prong with welded sphere stays on top of TCL, while the inferior prong is guided by the guide needle along its lower surface. Having done this, your operation is completed. In this inside-out video, you can visualize the cut ligament with two parts well spread apart across its entire length. Cosmetically, the results are unsurpassable. Within a few months, the scar virtually disappears. In conclusion, the in-sight precision carpal tunnel release technique. Simple, safe, effective, inexpensive, reliable, reproducible, requiring only a single wrist incision, performed without previous dilation of the content of the carpal tunnel. Open carpal tunnel release is not the gold standard. It is the old standard.